Hi everyone, welcome back to the Investing Iguana, where we talk about all things related to money and health. I'm your host, Iggy, and today we're going to discuss a very important topic. These 5 health problems are on the rise in Singapore. Are you one of the millions at risk? Singapore is known for its high standard of living, its efficient public transport system, and its delicious food. But did you know that Singapore also has some of the highest rates of certain health conditions in the world? According to the Ministry of Health, these are the top 5 health problems that Singaporeans should pay attention to. Let's start with the first health problem on our list, diabetes. This is a condition where your body cannot produce enough insulin or use it properly, resulting in high blood sugar levels. Insulin is a hormone that helps your cells absorb glucose from your blood and use it for energy. When you have diabetes, your cells cannot get enough glucose, and your blood glucose levels become too high. This can damage your organs and tissues over time and cause serious complications such as heart disease. Diabetes can increase your risk of developing coronary artery disease, which is when the blood vessels that supply oxygen to your heart become narrowed or blocked by fatty deposits called plaque. This can reduce the blood flow to your heart and cause chest pain, shortness of breath, or a heart attack. Diabetes can also increase your risk of developing heart failure, which is when your heart cannot pump enough blood to meet your body's needs. This can cause fluid buildup in your lungs, legs, or abdomen and make you feel tired, weak, or breathless. Kidney failure. Diabetes can damage the tiny blood vessels in your kidneys, which are organs that filter waste and excess fluid from your blood. This can cause a condition called diabetic nephropathy, which is when your kidneys lose their ability to function properly. This can lead to a buildup of waste and fluid in your body and eventually require dialysis or a kidney transplant. Blindness. Diabetes can damage the tiny blood vessels in your eyes, which are organs that help you see. This can cause a condition called diabetic retinopathy, which is when your retina, the light-sensitive layer at the back of your eye, becomes swollen, leaky, or scarred. This can affect your vision and cause blurry vision, floaters, flashes, or blindness. Diabetes can also increase your risk of developing other eye problems such as cataracts, clouding of the lens, or glaucoma, increased pressure in the eye. Amputation. Diabetes can damage the nerves and blood vessels in your feet and legs, which are parts of your body that help you move and balance. This can cause a condition called diabetic neuropathy, which is when you lose sensation or feel pain, tingling, or numbness in your feet and legs. This can make it hard for you to notice any injuries or infections on your feet and legs and make them heal slower or worse. This can lead to ulcers, open sores, gangrene, tissue death, or amputation, surgical removal of your toes, feet, or legs. These are some of the serious complications that diabetes can cause if left untreated or poorly controlled. Diabetes is not only a common but also a costly health problem in Singapore. Diabetes affects about 8.6% of adults aged 18 to 69 in Singapore, which translates to about 440,000 people. And this number is expected to rise to 1 million by 2050 as the population ages and becomes more sedentary. Diabetes is also a major risk factor for COVID-19 severity and mortality, as it can weaken your immune system and make you more prone to infections and complications. So how do you know if you have diabetes or are at risk of developing it? Well, there are 2 main types of diabetes, type 1 and type 2. Type 1 diabetes is an autoimmune disease that occurs when your immune system attacks and destroys the cells in your pancreas that produce insulin. This usually happens in childhood or adolescence, but can also occur later in life. Type 1 diabetes requires daily injections of insulin to survive. Type 2 diabetes is more common and accounts for about 90% of all cases of diabetes. Type 2 diabetes occurs when your body becomes resistant to insulin or does not produce enough insulin to meet your needs. This usually happens in adulthood, but can also occur earlier in life due to genetic or lifestyle factors. Type 2 diabetes can be managed with oral medications, insulin injections, or both. You can check with your doctor or the Health Promotion Board for the recommended screening guidelines and subsidies for Singaporeans. Screening tests can help you detect diabetes early when it can be treated more effectively and prevent or delay complications. Screening tests may include fasting plasma glucose test. This is a blood test that measures your blood sugar level after fasting, not eating or drinking anything except water, for at least 8 hours. A normal fasting blood sugar level is below 5.6 millimoles per liter. A prediabetes level is between 5.6 and 6.9 millimoles per liter, and a diabetes level is 7.0 millimoles per liter or higher. Oral glucose tolerance test. This is a blood test that measures your blood sugar level before and 2 hours after drinking a sugary drink. A normal 2-hour blood sugar level is below 7.8 millimoles per liter. A prediabetes level is between 7.8 and 11.0 millimoles per liter, and a diabetes level is 11.1 millimoles per liter or higher. HbA1c test. This is a blood test that measures your average blood sugar level over the past 2 to 3 months. It reflects how well you have controlled your blood sugar level over time. A normal HbA1c level is below 5.7%, a prediabetes level is between 5.7% and 6.4%, and a diabetes level is 6.5% or higher. If you are diagnosed with diabetes, don't panic or lose hope. Diabetes can be managed with proper medication, diet, exercise, and self-care. You can work with your doctor, nurse, dietitian, pharmacist, and other health professionals to create a personalized diabetes care plan that suits your needs and goals. You can also join support groups, attend education programs, or seek counseling to cope with the emotional and social aspects of living with diabetes. The next health problem that we're going to talk about is colorectal cancer. This is a cancer that starts in the colon or rectum, which are parts of your digestive system. The colon is the long, tube-like organ that connects your small intestine to your rectum. The rectum is the last part of the colon that stores your waste before it exits through your anus. Colorectal cancer is the most common cancer among both men and women in Singapore, with about 29 new cases diagnosed in 2023. That's about 29 new cases every day. Colorectal cancer is often preventable through early detection and screening. If you are over the age of 50, talk to your doctor about whether you should be screened for colorectal cancer. Screening can help find cancer early, when it is most treatable. Here are some of the symptoms of colorectal cancer: changes in bowel habits. This could include diarrhea, constipation, or a change in the consistency of your stool. Blood in your stool. This could be bright red blood or dark, tarry stool. A feeling of fullness or bloating. This could be caused by a tumor blocking the colon. Unexplained weight loss. This could be a sign of cancer or other serious health problems. If you experience any of these symptoms, it is important to see your doctor right away. Colorectal cancer is a serious disease, but it is also one of the most treatable cancers if it is found early. However, some people with colorectal cancer may not have any symptoms at all, or may have mild symptoms that they mistake for other conditions such as hemorrhoids, irritable bowel syndrome, or ulcerative colitis. That's why it's important to get screened for colorectal cancer regularly, especially if you are above 50 years old or have a family history of colorectal cancer. Screening tests can help you detect colorectal cancer early, when it is easier to treat and has a better chance of survival. Screening tests can also prevent colorectal cancer by finding and removing polyps or abnormal growths on the inner lining of the colon or rectum before they become cancerous. There are two main types of screening tests for colorectal cancer: fecal immunochemical test. This is a simple and non-invasive test that you can do at home. It involves collecting a small sample of your stool using a kit and sending it to a laboratory for analysis. The test detects tiny amounts of blood in your stool that may indicate the presence of polyps or cancer. You should do this test once a year if you are above 50 years old and have no symptoms or risk factors for colorectal cancer. You can get a free fit kit from the Singapore Cancer Society if you are eligible. Colonoscopy. This is a more invasive but more accurate test that involves inserting a thin flexible tube with a camera and light at the end into your anus and up your colon. The test allows your doctor to examine the entire length of your colon and rectum for any polyps or cancer. If any polyps are found, they can be removed during the procedure. You should do this test once every 10 years if you are above 50 years old and have no symptoms or risk factors for colorectal cancer. You can also do this test if your FIT result is positive or if you have symptoms or risk factors for colorectal cancer. If you are diagnosed with colorectal cancer, don't lose hope or give up. Colorectal cancer can be treated with surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy, or a combination of these methods depending on the stage and location of your cancer. You can work with your doctor and other health professionals to create a personalized treatment plan that suits your needs and goals. The third health problem is lung cancer. This is a cancer that starts in the lungs, which are organs that help you breathe. Lung cancer is the second most common cancer among men and the third most common among women in Singapore, with about 7,802 new cases diagnosed in 2022. Lung cancer can cause symptoms such as coughing up blood, chest pain, shortness of breath, wheezing, and hoarseness. Lung cancer is mainly caused by smoking, but other factors such as exposure to air pollution, radon gas, asbestos, or secondhand smoke can also increase the risk. Screening tests can help you detect lung cancer early, when it is easier to treat and has a better chance of survival. Screening tests can also prevent lung cancer by finding and treating precancerous changes in the lungs before they become cancerous. There are two main types of screening tests for lung cancer: low-dose computed tomography, LDCT. This is a type of X-ray that uses a low dose of radiation to create detailed images of your lungs. The test can detect small nodules or masses in your lungs that may indicate lung cancer. You should do this test once a year if you are between 55 and 80 years old and have a history of heavy smoking, at least 30 pack years, or have quit smoking within the past 15 years. You can get a subsidized LDCT scan from the Singapore Cancer Society if you are eligible. Sputum cytology. This is a test that examines your sputum, the mucus that you cough up, under a microscope for abnormal cells that may indicate lung cancer. The test can detect lung cancer at an early stage, especially if you have symptoms such as coughing up blood or rust-colored sputum. You should do this test if you have symptoms or risk factors for lung cancer and your LDCT scan is negative or inconclusive. If you are diagnosed with lung cancer, don't lose hope or give up. Lung cancer can be treated with surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy, or a combination of these methods depending on the type and stage of your cancer. The fourth health issue is corpus uteri cancer. This is a cancer that starts in the uterus or womb, which is where a baby grows during pregnancy. Corpus uteri cancer is the fourth most common cancer among women in Singapore, with about 2,602 new cases diagnosed in 2022. Corpus uteri cancer can cause symptoms such as abnormal vaginal bleeding or discharge, pelvic pain or pressure, difficulty urinating or defecating, and bloating. However, some women with corpus uteri cancer may not have any symptoms at all, or may have mild symptoms that they ignore or attribute to other causes such as hormonal changes, fibroids, polyps, or infections. That's why it's important to get screened for corpus uteri cancer regularly, especially if you are above 40 years old or have a family history of corpus uteri cancer. Screening tests can help you detect corpus uteri cancer early, when it is easier to treat and has a better chance of survival. Screening tests can also prevent corpus uteri cancer by finding and removing precancerous changes in the endometrium before they become cancerous. There are two main types of screening tests for corpus uteri cancer. Pelvic exam. This is a physical examination of your pelvic organs by your doctor or nurse. The exam involves inserting 2 fingers into your vagina and pressing on your abdomen with the other hand to feel for any lumps, masses, or abnormalities in your uterus, ovaries, fallopian tubes, cervix, and vagina. The exam can also include a speculum exam, which involves inserting a metal or plastic device into your vagina to open it up and allow your doctor or nurse to see your cervix and vagina. You should do this exam once a year if you are above 40 years old and have no symptoms or risk factors for corpus uteri cancer. Pap smear. This is a test that collects cells from your cervix using a small brush or spatula and sends them to a laboratory for analysis. The test can detect abnormal cells that may indicate precancerous changes or cancer in your cervix or endometrium. You should do this test once every 3 years if you are between 25 and 69 years old and have no symptoms or risk factors for corpus uteri cancer. The fifth and final health problem that we're going to cover is ovarian cancer. This is a cancer that starts in the ovaries, which are organs that produce eggs and hormones. The ovaries are located on either side of the uterus or womb in the lower abdomen. Ovarian cancer can occur as a malignant tumor in one or both ovaries. There are different types of ovarian cancer classified by the type of cell from which it originates. Epithelial ovarian cancer. This is the most common type of ovarian cancer. It develops from a type of cell that covers the surface of the ovary. It can also involve the fallopian tubes or the peritoneum, the lining of the abdominal cavity. Germ cell ovarian cancer. This is a rare type of ovarian cancer. It develops from germ cells that make the eggs. It usually affects younger women and can be treated successfully with surgery and chemotherapy. Stromal ovarian cancer. This is another rare type of ovarian cancer. It develops from connective tissue cells that hold the ovary together and produce hormones. It can be diagnosed earlier than other types of ovarian cancer because it often causes hormonal changes. Ovarian cancer is the fifth most common cancer among women in Singapore, with about 1,902 new cases diagnosed in 2022. Ovarian cancer can cause symptoms such as abdominal swelling or pain, feeling full quickly after eating, changes in bowel or bladder habits, back pain, and fatigue. Ovarian cancer can be difficult to detect early because it often does not cause any signs until it has spread to other parts of the body. Screening tests can help you detect ovarian cancer early, when it is easier to treat and has a better chance of survival. Screening tests can also prevent ovarian cancer by finding and removing precancerous changes in the ovaries before they become cancerous. There are two main types of screening tests for ovarian cancer. Pelvic ultrasound. This is a type of imaging test that uses sound waves to create pictures of your pelvic organs such as your ovaries, uterus, fallopian tubes, and bladder. The test can detect any masses, cysts, or abnormalities in your ovaries that may indicate ovarian cancer. You should do this test once a year if you are above 40 years old and have no symptoms or risk factors for ovarian cancer. CA-125 blood test. This is a blood test that measures the level of a protein called CA-125 in your blood. CA-125 is a substance that is produced by some ovarian cancer cells and can be elevated in women with ovarian cancer. However, CA-125 can also be elevated due to other conditions such as endometriosis, pelvic inflammatory disease, pregnancy, or menstruation. Therefore, this test is not very specific for ovarian cancer and should not be used alone to diagnose ovarian cancer. You should do this test if you have symptoms or risk factors for ovarian cancer and your pelvic ultrasound is abnormal or inconclusive. These 5 health problems are not only common but also costly. They can affect your quality of life, your productivity at work, and your ability to enjoy your hobbies and passions. They can also drain your savings and put a strain on your family and loved ones. That's why it's crucial to take preventive measures to reduce your risk of developing these conditions or to detect them early if you already have them. So what can you do to protect yourself from these health problems? Here are some tips that I've learned from my research and experience. Eat well. A balanced diet that includes plenty of fruits and vegetables, whole grains, lean protein, healthy fats, and water can help you maintain a healthy weight and lower your risk of diabetes and some cancers. Avoid foods that are high in sugar, salt, fat, or processed ingredients that can increase inflammation and oxidative stress in your body. Also limit your intake of alcohol and red or processed meat that can increase your risk of colorectal and other cancers. Exercise regularly. Physical activity can help you burn calories, improve your blood circulation, strengthen your muscles and bones, and boost your mood and immune system. Aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise per week, as well as strength training at least twice a week. You can choose any activity that you enjoy and that suits your fitness level, such as walking, jogging, cycling, swimming, dancing, or playing sports. Quit smoking. Smoking is the leading cause of lung cancer and a major risk factor for many other diseases. Smoking can damage your lungs, heart, blood vessels, and DNA, and make you more susceptible to infections and chronic conditions. Quitting smoking can reduce your risk of lung cancer and other diseases by up to 50% within 10 years. If you need help to quit smoking, you can consult your doctor, join a support group, use nicotine replacement products, or try other methods that work for you. Get screened. Screening tests can help you detect health problems early, when they are easier to treat and have a better prognosis. Depending on your age, gender, family history, and personal risk factors, you may need to get screened for diabetes, colorectal cancer, lung cancer, corpus uteri cancer, ovarian cancer, or other conditions. You can check with your doctor or the Health Promotion Board for the recommended screening guidelines and subsidies for Singaporeans. Seek help. If you notice any symptoms or signs that could indicate a health problem, don't ignore them or hope they will go away. Seek medical attention as soon as possible to get a proper diagnosis and treatment. Early intervention can make a big difference in your recovery and survival. Also seek help if you are feeling stressed, anxious, depressed, or lonely, as these can affect your mental and physical health. You can talk to your family, friends, doctor, counselor, or a helpline to get the support and care you need. These are some of the ways that you can take charge of your health and prevent or manage these 5 health problems that are on the rise in Singapore. Remember that your health is your wealth, and it's never too late to start making positive changes in your lifestyle. I hope this video has been helpful and informative for you. If you liked it, please give it a thumbs up and subscribe to my channel for more videos on money and health. Also leave a comment below and let me know what other topics you want me to cover in the future. Thank you for watching the Investing Iguana, and I'll see you in the next video. Stay healthy and happy.